maybe this was something that no country could be prepared for, right? It was an unknown virus, and it broke out in a large city, and it goes undetected for a while from what we know, or we still really don't know how the virus behaves, but it seems to be transmitted by people who are asymptomatic. So we probably don't even know how long the virus was out there in humans before it was detected by, Dr. Lee. They mobilized everything and quarantined entire cities. 50 million people were quarantined, and they've gotten it under control. As far as we know, there are almost no new cases in most of China, and they're continuing to be very, very vigilant. You can't go into Beijing right now from outside of Beijing without being quarantined for 14 days. If we're at a point where we're seeing very, very little incidents, how long can you keep the country closed? 250 million people migrate around China, depend on itinerant forms of labor to support themselves and their families, and that's not something that you can continue to stop, both because of their contribution to the economy's need for them, their need to support their families, their need to get back to where they live. Probably at this point, the best mechanism is, now that they understand a little bit more about this virus, let people go back to work, let people go back to where they come from, and hopefully there are more local, regional modes of prevention that they can put in place, right? Once they have people back to where they come from, and once they have people, working again. I think people who are going back to work are taking preventative measures. Any business that wants to open at this point has to pass a test of 5 different types of evaluation, right? And one piece of evaluation is whether they're promoting good public health practice, right? So it's not just, let people go back to work, let people go back to school. It's let people go back to work because we need them to go back to work. The country needs them to go back to work, but we'll also put in place preventative health measures to make sure that businesses that are reopening are doing that in a responsible public health way. Absolutely. Absolutely. Right. So now what we're talking about, everyone's posting on their Facebook page this graphic about flatten the curve, right? And that comes from a lesson that we learned from the 1918 Spanish flu. There's a graphic that's been shown that tells us what happened in Philadelphia, and Philadelphia did not put into place, quarantine measures during the 1918 flu, and so the curve in Philadelphia is really, really, really steep, right? It's not as long, but it's a very, very steep curve, and results in a lot of deaths. But that curve is laid over a curve in St. Louis, which is longer, but much, much flatter. So the length of the epidemic in St. Louis was longer, but the mortality rate is much, much lower. And so, that was a lesson learned by our country, by the world. Knowing what's going on in one area informs people in another area. And, if you can sort of restrict the spread of the epidemic from the original location, then other locations have time to prepare. Why that didn't happen in this country, I don't know. That's going to be one of the biggest questions. We should have been more prepared. We see second by second, minute by minute, what's going on in China. There's no problem these days with social media, and we just should have been more prepared. But that being said, the outbreak is slowed down here. It definitely is, because we know how to prevent it. And we do know that if someone's diagnosed, we should be tracing their contacts and quarantining those people. And sometimes even to a second level, to a second relationship, people are being self-quarantined. The outbreak is being, it's slowed down here. Our worry, and this is something else that we should have learned from Wuhan, and Italy should have learned from Wuhan, is that our public health system will be overloaded. Our hospital system will be overloaded. They can see what's coming down the pike. And I would not be surprised at all if it's the major hospitals that are driving all of these policy implementations. That's a great question. And I would say yes, but I would qualify that because I don't think we've paid enough attention to what's happened to China already, to the actions that China already took. And if we were paying enough attention, we probably would have quarantined people already. We have a hard time doing that. We have a really hard time doing that for a couple of reasons. One is because we're not ruled by an authoritarian government. And so it's hard to tell people, what to do. One of the other reasons why we have a hard time doing that is because we're a very individualistic society. And I can't tell you the number of people I hear around me when they hear of, a suggestion that they should be quarantined, they're all in favor of someone else being quarantined. But when you tell them that they may have to self-quarantine, or when you tell them that there's a new policy in the organization, we don't want people traveling for business, and we strongly discourage people from, traveling for personal reasons, which is an imperfect policy to begin with, right? You can contract disease just as easily if you're traveling for business purposes than for personal reasons, but you can't tell people to, or we think, right, in our neoliberal society, we can't tell people to not travel for personal reasons. And so when you release these policies, people, oh yeah, that's great, but what about that trip I was supposed to take? It's really hard for us to think in terms of protecting society. It's hard for us to give up our individual rights. The other thing that I think hinders our response is the fact that we don't have much of a social safety net in our country. It was really interesting in comparing the SARS outbreak and the Ebola outbreak in West Africa in 2014. When China went to West Africa in 2014, brought 1,200 healthcare workers and tried to help them institute a quarantine policy, and it could not be done. People rioted because they wouldn't have food. When people were quarantined in their homes in Beijing in 2003, the government assured them that they would have food, right? And there are social safety nets. We don't have social safety nets here of, ensuring food. What happens if we're quarantined? I'm fine, right? I have the wherewithal to have gone out over the past couple of weeks and, increased my stock of food at home. There are a lot of people around me who don't have that ability. What will happen to them? What about childcare? What about people who, live paycheck to paycheck? That creates another level of challenge for us in following what China did. So if we didn't follow what China did, can we necessarily look towards what they're doing and what they're going to do? I don't know that we're on this sort of right level of playing field at this point to do that.